alpha-man is a very rare lysosomal storage disorder, and it consists of an enzyme deficiency. So patients cannot produce a specific enzyme, which is alpha-mannosidase. This is a lysosomal enzyme, so it has a specific role within the cells, and it basically cleaves oligosaccharides, which are the substrate, a specific substrate. Without the specific enzyme, these sugars, these oligosaccharides, will accumulate into the cells ubiquitously, which means basically potentially in every single cell in the body. What this means is that alpha-mannosidosis, or alpha-man for short, becomes a metabolic and a systemic disorder that impacts multiple functions in the body of a patient. Alpha-man is also, as I said, rare, so we know that we believe that the prevalence of it can be maybe 1 in a million, maybe 1 in 500,000, maybe 1 in 2 million, depending on the source. There's various different studies that have been conducted, but it's very rare. It typically is diagnosed relatively soon because there are some very specific features that are characteristic of this disease. And so typically the diagnosis happens at a pediatric age. The course of the disease is slowly progressing, but not because it's slowly progressing, it's in any way, shape, or form less devastating on the patients. Over time, patients develop recurrent issues such as recurrent infections at the respiratory tract as well as the urinary tract. They also progressively, unfortunately, lose their motor function. And so some of the patients over time essentially, become wheelchair bound, and their motor function is heavily, severely reduced. They can't walk the steps or can walk the stairs, and they essentially become weaker and weaker. Alpha-man also has a significant central nervous system component, which leads to progressive neurodegeneration, which is also part of the complication of the problems related with the degeneration of the motor function as well. It also leads sometimes to the expansion of organs, organomegaly, right? It doesn't happen in every single patient, but it certainly has something to do with the fact that with this enzyme deficiency, in some cases, many cells become larger and larger because they can't expel the substrate, the sugars in excess.